Hi, my name is Zechariah Heintzelman. This is the intro to my practical for HSES 473. So we're going to talk about first, before we get into the actual testing, is consenting and risk stratification. So for consenting, obviously you want to have patients sign any consent forms that you have at your facility, as well as always get verbal consent before touching or administering an exercise test to a patient. And then once that stuff has been acquired, you're going to want to do risk stratification. So what we use is a PAR-Q, or a physical activity readiness questionnaire for everybody. It goes through a risk stratification questionnaire that talks about their previous medical history, their family's previous medical history. We're really looking for risk stratification of non-communicable diseases like cardiovascular disease, pulmonary disease, or metabolic diseases. Once they go through that questionnaire, if they have one or fewer risk factors, they would be considered low risk. Any more than 2 risk factors would be considered moderate risk. And if they have an active diagnosed cardiovascular, pulmonary, or metabolic disease that has been diagnosed by a physician, then they would be considered high risk. Anybody moderate risk or higher, they should get some form of medical clearance from their physician before going through exercise testing. If they are low risk, then you can do exercise testing on site that day. And then obviously if they don't have any risk factors, they could be considered no risk. So we are now going to go into our full testing. We're going to do body composition with body fat and BMI. We are going to do vitals, so we will be testing blood pressure and heart rate. We're going to do muscular endurance. We're going to be doing the YMCA curl-up test. And then due to lack of equipment, we are going to do an equation estimated VO2 max. And we will put that in the document so that you can see it. This is going to be administered on Lydia Heintzelman, as my wife. I didn't have time to make it to the lab, so we are doing it here in our home. And yeah, so rest of the video coming up. Okay, so this is my PAR-Q questionnaire for my practical for HSES 473. We're going to go over the PAR-Q questions with my client Lydia. And this is just how I would go through this questionnaire with a client if I were sitting in front of them before we have gone through with exercise testing. So we have already gathered consent forms for everybody from Lydia for exercise testing, and we're just going to hop right into the questionnaire. So this is the 2020 PAR-Q, which is the physical activity and readiness questionnaire for everyone. Essentially what this does is it's a screening way, or it's a way for us to screen clients and see if they are ready for physical activity or exercise testing without a physician's help. So we'll just go through these questions, and then we'll decide whether or not we need a physician's clearance before we go forward with exercise testing for you. So you can just answer these questions with yes or no, or you can go into anything if you need. So first question is, has a doctor ever said that you have a heart condition or high blood pressure?
No.
Okay. Do you feel pain in your chest at rest during daily activities or when you do physical activity?
No.
Okay. Do you lose balance or dizziness, or have you lost consciousness in the past 12 months?
No.
Okay. Have you ever been diagnosed with a chronic medical condition other than heart disease or blood pressure?
No.
Okay. Are you currently taking any prescribed medications for a chronic medical condition?
No.
Okay. Do you currently have, or have you in the past 12 months had a bone, joint, or soft tissue problem that could become worsened by doing physical activity?
No.
Okay. And then has a doctor ever said that you should only do medically supervised physical activity?
No.
Okay. So we're going to move to the next question as follow-up questions for the PAR-Q. Do you have arthritis, osteoporosis, or back problems?
No.
Okay. Do you currently have a cancer of any kind?
No.
Okay. Do you have a heart condition, cardiovascular condition that includes cardio or coronary artery disease, heart failure, or a diagnosed abnormality of the heart rhythm?
No.
Okay. Do you currently have high blood pressure?
No.
Do you currently have metabolic conditions that include type 1 diabetes, type 2 diabetes, or pre-diabetes?
No.
Okay. Do you have any mental health problems or learning difficulties?
Yes.
Okay. Do you have issues controlling your condition with medication or other physician-subscribed therapies?
No.
Okay. Do you have Down syndrome and back problems affecting nerves and muscles?
No.
Okay. Do you have any respiratory diseases, including chronic obstructive pulmonary disease, asthma, or pulmonary high blood pressure?
No.
Okay. Do you have a spinal cord injury that includes tetraplegia or paraplegia?
No.
Okay. Have you ever had a stroke?
No.
Okay. So go ahead and list for me any medical conditions that we did not talk about above, the conditions that you said yes to, and then the medications that you take for those.
I am diagnosed with seasonal depression, social anxiety, OCD, and ADHD, and I take Strattera and Prozac to aid those.
Okay, awesome. Perfect. And that is it. Okay, so this is blood pressure for Zechariah Heintzelman's practical for HSES 473. So we're going to talk about how we're going to take this blood pressure, and then I'm going to take Lydia's blood pressure here. So we're going to start by talking about the equipment. We're going to have a stethoscope and a blood pressure cuff. On your blood pressure cuff, you have your pump and then your gauge. Most blood pressure cuffs have exactly how to set it up on there, but what we're going to do is we're going to take it about middle of her arm, about an inch above where her elbow is going to bend, and usually there is an arrow on the blood pressure cuff that points where it needs to be pointing on their brachial artery. So we're going to tighten the blood pressure cuff to where we can fit about 2 fingers inside the top of the blood pressure cuff. The arrow is facing down the brachial artery about an inch above where their elbow bends. Then we're going to inflate the blood pressure cuff to about 40 millimeters of mercury above their normal resting blood pressure, which with Lydia's is 120/80. This, as we're inflating it, we're going to put the stethoscope right above their brachial artery where their elbow bends, and we're going to be listening for the Kirchhoff sounds, which are the thumping sounds that you hear at the sound of the first Kirchhoff sound. That is going to be representative of her systolic blood pressure. And then when you stop hearing the Kirchhoff sounds, that last thump is going to be representative of her diastolic blood pressure. And then you're going to note those on paper right after taking it. Notice how she's sitting. She's sitting upright. Her shoulder is relaxed, and her her arm is supported at about or just below shoulder height by a hard surface so that she does not have to lift her arm. So we're going to place the stethoscope right above her brachial artery, not pressing on the drum, just pressing on the sides. And we're going to inflate the blood pressure cuff 40 over her resting blood pressure, and then note the systolic and diastolic blood pressures. Alrighty, and her blood pressure was 122/82. All right, so now we're going to go over heart rate. Similar situation as last time, we're going to have the client sitting. We're doing resting heart rate, so they're going to be sitting for at least a couple of minutes to let their heart rate naturally rest. We are going to test her carotid pulse, which is just about an inch under her ear, under the crease of her jawline. We're going to be feeling for that pulse and counting the beats for 10 seconds, and then we'll multiply that beat or those beats by 6 to get how many beats she would have in a total of 60 seconds, which is heart rate per minute. So we're going to set a timer for 10 seconds. Alrighty, so that was 10 seconds. She had 15 beats. We're going to multiply that by 6, and she is at 90 beats per minute. Okay, so this is BMI for HSES 473 for Zechariah Heintzelman. So first we're going to gather the client's weight and then their height so that we can do that ratio. I already have my scale set to kilograms. If you have it set to pounds, you will have to do that calculation to transfer it to kilograms. So I'm going to have the client do first is make sure that the scale is on a flat level surface, and then they're going to either step on it or wake it up, however that works. Once the scale is awake, they're going to step on it. Then we're going to gather their weight, which is 69.5 kilograms. I'm going to have her step off of the scale. We are going to get it twice. So once it zeroes back out, they're going to step on it again to wake it up. And then they are going to step on the scale, and we are going to note their weight again, which is 69.5. So both measurements are 69.5. Her weight is 69.5 kilograms. Now we're going to gather her height. So I'm going to have the client come to a flat level surface on flat hard ground. We are going to have their heels pressed up against the wall and their head pressed up against the wall, as well as their body flat against the wall the whole way. You're going to take a hard, flat object to create a right angle at the top of the wall. We're going to slightly depress their hair, and then we are going to have them step away from the wall so that we can mark that spot. Then we'll take a tape measure, place it all the way against the floor and up. And then we're going to mark, and she is 170.5 centimeters tall. So after you gather these two equations, you will do weight divided by meters squared, which we have already calculated over here. Her weight was 69.5 kilograms. Her height was 170.5 centimeters, or 1.705 meters, which calculates as 22.72 on the BMI ranking scale, which okay, so now we are going to go over body fat percentage. We are using skin fold measurement. Since this is a female, we are going to do her tricep skin fold measurement, her suprailiac skin fold measurement, and her thigh measurement. We're going to take all of these tests on the right side 2 separate times. You'll do each of the 3 measurements once, and then you will do each of the 3 measurements a second time separately. We're only going to record the first one, then we're going to do the second one outside of video. You're going to average out those values, and then you are going to use those values to put into the equation to calculate her body fat percentage. So what we're going to do first is we're always going to get consent to touch the patient. Do I have your consent to get your skin fold measurements?
Yes.
Okay, awesome. So what we're going to have her do first is turn around. We're going to do her right tricep skin fold measurement. To find out the measurement site for this one, I'm going to have her relax her arm. We're going to measure the half of the distance between her olecranon and acromion process, which is right here at about 6 inches. We are going to mark with a marker about halfway in between her arm. Up and down, this is a vertical fold measurement. Once you have that mark, you will take your skin fold calipers. You're going to pinch the skin about 1 centimeter above that mark, and then we are going to take the skin fold calipers and let it clamp where that mark was and let it rest for about 2 seconds, then take it off, immediately marking your measurement on your page, which is 15 millimeters. Okay? We are now going to test her iliac or her suprailiac skin fold measurement on her right side. I'm going to start by having her roll down her shorts because they're covering. We want to measure this one about 1 centimeter above her iliac crest of the hip, which is right about here. So we will take our tape, go about 1 centimeter above at the mid-axillary line, and this is an oblique fold. So once we are here, we are going to draw a diagonal line following that crease. And then just like with the other one, we are going to pinch the skin about 1 centimeter above that mark, pinching that crease with the skin fold calipers and releasing, and that one shows as 12 millimeters. Finally, we are going to take her thigh measurement, which is going to be halfway between the iliac crease and the superior pole of the patellar. So we're going to measure there, find about halfway, which is at about 19.5 centimeters. We're going to mark a vertical fold. And then just like the other ones, we're going to pinch about 1 centimeter above that. Put the skin fold calipers on, let them rest for 2 seconds. We have about 19 millimeters for that measurement. After you're done, you will then go through and take the rest of the measurements, all still on the right side. You'll average out the values, put it into the equation, and then you will get the client's body fat percentage, which we will go over in a later video. Okay, so for muscular endurance, we are going to do the YMCA partial curl-up test. The way that we have this set up is the client is in the supine position with bent knees. We have 2 sections of tape 12 centimeters apart because the client is under the age of 45. When they are resting, their arms are straight on the ground and their fingers will be at the edge of the tape. They are looking to, as they curl up into a sit-up position, reach their fingers past the other edge. They will be doing this at 40 beats per minute. The only things that will terminate the test is that they can no longer do a full curl-up, their feet come off the ground, or they have done 75 curl-ups over the timer. So we are going to have the client start at 40 BPM, and then we will note how many they completed. I will let you know when to start. All right, we are going to be starting in 3, 2, 1, go. All right.
Okay.
So it looks like that was 9 curl-ups, and then we would note that on our page. Okay, so for this one, we are going to do the sit and reach mobility test. We do not have a sit and reach box, so we're going to use the meter stick method. What we're going to have the client do first is sit down with their back straight. We are going to have them place their heels about 12 inches apart. We can measure that with our tape here. Okay, then after that, we're going to take either a tape measure or a meter stick. We are going to find the 15-inch mark and place that at the edge of their heels where that marker is. Okay, what we are going to have them do is sit up nice and tall, inhale, and then they are going to exhale and reach with one hand over another as far as they can. Once they're done with that test, they will sit back up straight, take another deep breath, and reach as they inhale. We will do this test 3 separate times in the same sitting, and then we will average out those value, or take the highest value as the marker for this test. So I'm going to have the client inhale. I'm going to hold the meter stick nice and still, and then as she exhales, she's going to reach down as far as she can. She went to about 19 inches, so she's going to sit up straight, take another deep breath, and reach as she inhales down. Good, that was about 19.5 inches, and then she's going to, one more time, inhale, sit up straight, exhale, and reach as far as she can. And she reached about 20 inches that time, so we'll take that. 20 would be her highest value for the YMCA sit and reach test. Okay, so we just went through all of your exercise testing and your PAR-Q and your consenting form, so we're going to go over your results of your exercise tests. So, as we stated, your name is Lydia Heintzelman, you're 25 years of age. We measured you as 170.5 centimeters tall. Your body mass is 69.5 kilograms. Your age predicted max heart rate is 195 beats per minute, which is 220 beats per minute minus your age is how you calculate that. That puts your 85% max heart rate at 165.75 beats per minute. So to round up, that's about 166 beats per minute. After we did your PAR-Q, we classified you as low risk for cardiovascular risk, which means we do not need to have a physician present when doing exercise testing. So let's get right into your test results. For resting blood pressure, we tested you at 122 over 82 millimeters of mercury, which put you as slightly pre-hypertensive. Nothing to be worried about for somebody who's getting right back into fitness, who is under the age of 30. It's only 2 millimeters of mercury above the normal range, so that should come down after a couple weeks of exercise. So that's a pretty safe range to be at. For your resting heart rate, we have you at 90 beats per minute, which is in normal range. Anything under 100 beats per minute at your age is normal range, so your resting heart rate is nice and healthy. Your BMI, which is your body mass divided by your height in meters squared, rated as 22.72, which puts you in normal range between 18.5 and 24.9 for your age, height, and gender. We then tested your skin folds with those calipers. At your gender and age, you are within normal range at 19.7% body fat. For your sit and reach test, which was the mobility test that we did, your highest trial number was 20 inches or about 50.25 centimeters, which puts you at exceptional mobility. So you have really good mobility. That's something that is great for you. For muscular endurance, we did the YMCA curl-up test. That was when we were doing partial sit-ups. You got 9 repetitions at the cadence of 40 beats per minute, which puts you at well below average. So muscular endurance is something we might want to work on in the future just to get that range up just a little bit. And then due to a lack of equipment, we did a non-exercise estimate of your VO2 peak, which measured at 34.36 milliliters per kilogram per minute. So we did this as a sedentary adult because you're just getting back into exercise. So we are assuming that your sedentary lifestyle carried up until about when this test happened, and that puts you at fair. So just below the average mark. So getting yourself conditioned here in a couple weeks should really bring that value up. So those are all of your quantitative results. Is there any questions that you have for me?
How do I improve my muscular endurance and my cardiovascular fitness?
Yeah, that's a great question. So for your muscular endurance, what we're going to do is we are going to exercise those key muscles. In the test that we did, it was going to be core muscles, but you can test them, all of them. We're going to be at a lower RM range. RM means rep max. So we're going to be at a lower percentage of our 1 rep max. 1 rep max is how much weight you can push for 1 rep before your body can't push anymore. So we're going to be at about 40%, 40 to 60% of your 1 rep max, going for 12 to 16 reps. That's going to put you in a muscular endurance phase. And we do want to make sure that we're prioritizing a high protein diet so that we're fueling our muscles properly. And you'll do that for all separate muscle groups. You'll do 2 to 3 sets per large muscle group per day. And I want you to do that 3 to 5 days a week. Okay, and that'll help you with your muscular endurance. For cardiovascular fitness, it's best recommended that 5 days a week we do at least 30 minutes of moderate to high intensity cardiovascular activity, so that we can bring up that lactate threshold as well as bring up that VO2 max so that your body can more properly use the oxygen that it needs to go through those high intensity exercises. And then, like I said, just making sure that we're properly fueling our body for that exercise, and you should be great. You should see those numbers start to rise. So that's good.